coming here from Goshen Health. As Tom said, we're in northern Indiana, about 2 hours east of Chicago, close to Notre Dame. We are an organization that has a fairly unique culture, and we started, our hospital is over 100 years old. We are an independent, not-for-profit, small community health system, so that's very unique in and of itself. But there are several aspects of our culture that I think are fairly unique. So many of you have an RN residency program. We do as well. We've partnered with Vizient. Our residency program has been in effect since 2007, and we partnered with Vizient around 2017, 2018. We have around 25 to 35 residents each year. So all of our newly licensed nurses are put into our residency program. And Lisa Helfrich and Michelle Lambright, who are on the call, are the facilitators for residency. We're also a 5-time magnet designated organization. So we definitely have that culture of using evidence, ongoing improvement, having that professional practice environment that really embraces that. And then something that I think makes us unique is the Uncommon Leader program. And I'll explain a little bit more about that in just a moment. So looking at residency, as Tom said, we implemented we implemented Ovid Synthesis in 2024. And what we noticed was a big change in our evidence-based practice projects. So before we used Ovid Synthesis, the process was much more cumbersome, complicated. The residents did a search and had to print out all of the articles they found. So it was paper-based. They usually found 3 to 4 articles. The process to analyze them and appraise them, again, was paper-based and confusing. Heard a lot of comments like, I wish we didn't have to do this. I don't understand the steps. It took them also quite a bit of time when they were done with their project to then formulate their PowerPoint so that they could present it to the nurse leaders at graduation. And then we did introduce Ovid Synthesis and a complete turnaround. So instead of complaints, we heard things like, I wish we had this in college. With Synthesis and that built-in search from their PICO questions, they are finding more articles and better quality of articles. The mentors that are working with them are also on the platform, so it makes that collaboration much better, much more easy. They also, because they can see the chevrons at the top of the pages and see how the process works for their residency evidence-based practice project, it makes more sense to them. So they're coming away with a better understanding. And the beautiful part with the dissemination is that they can press a button, and instead of spending hours manually typing everything in, Ovid Synthesis puts it in that PowerPoint format that then they can edit if they want to. So really great improvement with efficiency, understanding, and the quality. So at the end of residency, we provide a survey with all of the different topics that we cover in our 9-month program. And what we found was before Ovid Synthesis, the residents rated their satisfaction a little bit lower. So afterwards, we had an average of a 39% increase in their satisfaction score, which is pretty significant. And again, if they have that foundation where they experience doing evidence-based practice and it's a positive experience, we anticipate that they will continue to carry that on through their professional nursing career. So the second part of our culture then is that magnet designation. Again, 5 times magnet designated, the last time with distinction. And so our professional governance is pretty strong here. We often hear in our governance councils about do-it groups. They're called DIGs. That's part of our Uncommon Leader culture. And they're basically small performance improvement projects. So we hear about those. We hear about evidence-based practice projects. Again, with the paper forms, it was a little more cumbersome. And so one of our goals in our nursing strategic plan was to enculturate the use of evidence-based practice tools. So Ovid Synthesis has been really great for us to help enculturate and continue to build on that culture that we already had, but to continue to make it stronger. So we're, again, excited for that 20 years of recognized excellence and how partnering with the innovative products can continue to help us to grow. So some of the improvements, again, that we've already seen by having synthesis available for our evidence-based practice projects. We had our first research expo. So Lisa was a big planner for that. First research expo last year, and not quite half were our RN residency projects. So we've already seen in the first quarter of 2025, we have already more than doubled the projects. I'm sorry, not doubled. We have almost half of the projects already that we had in the entire year in 2024. We've also noticed that beyond nurses, so we have social workers who are asking, hey, can we be involved? We've got a lot more engagement in evidence-based practice because people see how much easier it is. So I'm the Magnet Program Director here at Goshen, and some of the things that I'm really excited about are the improvements with efficiency that I can see when we start to write our 6th Magnet document. So for our 5th document, there are a couple of examples that we found. One of our RN residency projects, actually, we were writing about it to have changes in practice. So we were going to write about it, but the evidence didn't include the references. So I spent a lot of time trying to redo their literature search and try and figure out which references they use so I could notate those. With Ovid Synthesis, I not only have the repository of all of the evidence-based practice projects, but it has the references in the right format. So I can see that it will save a lot of time writing our next document. We also have some nursing research specialists. They very rarely, if I don't think ever, work together in the same building at the same time. So having the Ovid Synthesis platform will allow them to collaborate with their research projects. So with the gain shares that we get, one of the things that I think is going to be a benefit is that Ovid Synthesis has the return on investment projection. And that projection is like a checklist that helps us to identify what are some of the potential costs that people may not think of. What are some of the revenue or cost avoidance opportunities? Are we going to prevent some hospital-acquired conditions? Are we going to increase our throughput? And that just helps us to better, more quickly frame what our potential ROI is. So I think it also will help us as we look at projected some of the projects, those that have a higher projected ROI. You know, we can prioritize those. We can potentially spread those to replicate some of the successes. We have about 75 gain shares that are submitted each year. And so if that projected ROI can help make that process a little bit easier and potentially save some money, some time is money. And so I think that will also help us as well. So that is really how I see Ovid Synthesis helping us to already have changed some of our culture and some potential for the future. We've not implemented it yet in our TUL, but we have implemented in our residency and for our evidence-based practice projects for all of our colleagues.